Police shot and killed Koben Henriksen near Mall 205. We're told the 51-year-old was armed with a knife when he encountered officers Sunday afternoon. Something happened and those officers fired non-lethal and lethal rounds at Henriksen, ultimately killing him.
It turns out Henriksen is no stranger to law enforcement. In fact, on November 14th at 102nd and Stark, he encountered two officers. We know that Henriksen was wrapped in a blanket. He approached one of the officers, dropped the blanket, and he had two knives, one in each hand, and he threatened to kill the officer. Fortunately, those officers right here de-escalated the situation. Weeks earlier, on August 22nd, this time on the Portland Adventist Academy campus, we know that Henriksen encountered one officer. He told the officer that he was happy to see them because he needed somebody to kill him. He went on to tell that officer that he had been trying to get veterans to buy him weapons, but he was unsuccessful. The officer in this situation also de-escalated the event.
We must do better for those in crisis on our streets.
Portland Mayor Ted Wheeler believes the mental health system as a whole failed Henriksen, and something must be done.
I will commit to the people of this city that I will do everything in my power to help vulnerable people in our community get access to the services they need.
We have a very good system here in Portland and in Oregon for that matter. It's just we don't have the resources.
Gerald Walker is the president and CEO of Cascadia Behavioral Health Care. He says there are just too many people who need help and too little funding.
It's not a broken system. It's not a system that doesn't know how to do this. It's a system that doesn't have the resources adequate to meet this huge demand. There's no question about that.
All right, Walker calls himself an internal optimist, and he believes better days lie ahead. In the meantime, Portland City Commissioner Joanne Hardesty is also weighing in on this. She released a statement saying the mental health system is not the only system that failed Henriksen. She's hoping we use this opportunity to work on all systems that continue to fail the most vulnerable.